Well, today, the labor contract for nurses at Cleveland Clinic Akron General expires without an agreement on a new deal. Nurses say they plan to picket the hospital beginning next week.
Senior health correspondent Monica Robbins explains what the sticking points are and what may happen next.
They call it Code Red. The Ohio Nurses Association, representing 700 nurses at Cleveland Clinic Akron General, says nurses across Ohio and the nation are overworked, underpaid, and a lack of staffing puts patients at risk. Hospitals blame the nursing shortage.
We were told in our last contract that they would not put anything in the contract that they knew that they could not uphold. And so, again, safe staffing is extremely important to our nurses.
Safe staffing is part of a bill introduced in the Ohio legislature. If passed, it would establish minimum nurse staffing standards in Ohio hospitals and keep them accountable. Lentz says research shows a 4-patient to 1 nurse ratio is what's considered safe, but that's not happening.
Currently, our nurses are taking anywhere from 5 all the way up to 8 patients on an assignment.
But safe staffing goes beyond patient care, as Cleveland Clinic CEO and President Dr. Tom Mihaljevic discussed last week at the City Club.
Our caregivers are exposed to a tremendous amount of violence and abuse in their daily work.
Adding that these instances have doubled in the last 4 years. In a statement, Cleveland Clinic Akron General said, quote, "We are continuing good faith negotiations with the nurses bargaining unit. Our goal is to achieve a mutually agreeable contract renewal as we have in past years. Akron General greatly appreciates the care provided by all caregivers, including those in the bargaining unit."
Now, House Bill 285 that would require hospitals establish registered nurse staffing plans has been in the Health Provider Services Committee since its introduction in early October. The Akron General nurses are also fighting for wage increases and fair benefits.
So, contract expired, picket line, that sounds like a strike.
Yeah, actually, it does sound like a strike, but no, this is an informational picket. The nurses are well aware of how important they are to patients, so they will work their shifts and then picket afterward. If they come to a tentative agreement before next Wednesday, though, they will not be picketing at all.
Interesting. Okay, Monica, I'm sure you'll keep us up to date. Thank you.
Thanks, Mon.